Hello, and welcome to Working with Behavioral Challenges. My name is Lorraine Henriksen. I am the Director of Programs and Public Policy for the Alzheimer's Association. My colleague and I will be talking to you today about working with the behavioral challenges that are involved in being a caregiver for persons with dementia. Our overall goal is to help us all to obtain a better understanding of successful ways to work with persons with dementia, and most of all to understand what behavioral changes are caused by dementia and exactly what the word dementia means when we're talking about persons for whom we are caring. We want to learn how to be a more successful caregiver. And in order to be a more successful caregiver, we have to focus on creating a successful environment and developing successful strategies to work with those with dementia. Dementia, first of all, must be understood as a disease. In fact, even beyond a disease, dementia is really a name for a grouping of diseases and symptoms, all of which are characterized by a failure in the brain. It's very, very important to remember this in working with those individuals, that this is a disease. This behavior which we see is not purposeful. Many times it is the result of failure in the brain, and we will talk a little bit about what that entails and what the brain of the person with Alzheimer's actually looks like and what various areas of the brain are involved. One of the things you will note in working with persons with dementia is that they are often confused and often wondering about what you are trying to convey to them. Oftentimes people with dementia are saying to themselves, "What is this person telling me to do?" Dementia causes a progressive loss of memory, judgment, impulse control, abstract thinking, and language abilities. Because of that, you will see failures of all of these functionings, and you will often see these failures occurring together or separately, and you will see them occurring at various times of the day and in various situations. Flexibility is always the key in working with patients with dementia. Different areas of the brain are responsible for the behaviors that are observed in patients with dementia. As the disease becomes more prevalent, different areas of the brain are affected, and that will cause the behaviors that we will be talking about. Alzheimer's as a disease is first apparent in the hippocampus, which is the center of the brain. And because of this, one of the first things we notice in persons when they begin to develop a dementia is a loss of short-term memory. As the disease attacks the hippocampus, it attacks the short-term memory, and eventually new memories become impossible to make. And for persons with dementia, learning is a thing of the past. When we talk about behavior, it then becomes obvious that we are the ones who have to do the learning. Persons with dementia are no longer capable of learning not only new subjects, but many times they're not capable of recalling something that they actually were capable of telling you about a half an hour ago or even 10 minutes ago. Without knowing what has happened in their past and without even being aware of what is likely to happen during the course of the day, they lose the ability to judge things like time and place. And they also lose actually their perception of where they are in relation to time and place. They don't understand what's going on around them. And all of these symptoms are the result of brain failure, damage to the cells of the brain. When you look at a PET scan of an Alzheimer's brain, it becomes obvious that cell damage has actually resulted in huge areas of the brain no longer being active. And so when we're looking at a scan and we see dark areas of the brain, this is the result of the actual death of brain cells, of neurons within the brain. Dementia has many symptoms. One of the things we first notice is a change in behavior, and we also see a change in personality with persons with dementia. The important thing to remember about this behavior is it's not random. It is that it has no malicious intent. As caregivers, often we will take this behavior personally because we are human and our feelings can be hurt, and because we may have a limit to our patience, which we all do. Sometimes the behavior of the patients will be very difficult to manage and may appear spiteful or hurtful. This is the only form of behavior many of our patients will have. The only way they have to communicate with us is through their behavior. Here are some of the common behaviors that you will encounter. Wandering and pacing at various times of the day and various environments is extremely common in patients with dementia. Calling out and actually repeating either the same phrase or the same word over and over again is also a symptom of dementia. Many persons with dementia find the bathing and grooming experience to be incredibly difficult. They will often resist every attempt to bathe or to carry out personal care. The most overwhelming emotion I have seen in persons with dementia is that of fear. And fear is a direct result of being incredibly confused and incredibly poorly informed about the universe around them. They try to use everything in their environment as a cue, but as you can imagine, many times their perceptions are difficult and their perceptions are inaccurate. This leads to a lot of anxiety, leads to a lot of anger and frustration and fear. Many times persons with dementia will exhibit paranoia. They are scared and they may attribute motives and imagine things that are actually not happening. They suffer from both visual and auditory hallucinations. Persons with dementia do actually see things which are not there. They actually hear things that you cannot hear. They do also have delusions. In other words, they think things are occurring. They think that people may be stealing their money. They think that someone may be attempting to hurt them. They may see and feel that other people are in a room with them, even though you and I cannot see them. This behavior or these feelings often lead to losing and hiding things, which is another disturbing aspect of the dementia behavior. So how do we approach persons with dementia? The most important thing we need to remember here is that we have to be in charge, and we are the people who have to change, because persons with dementia are not capable of changing their behavior. If they were, and if they had the choice, certainly they would not be behaving in some of the ways which they exhibit. So we change our attitude from a negative to a positive. We have to learn to try to see things as they see them, so we have to change our own perceptions. We have to sometimes be willing to change our social roles in our approach to these individuals. And we also have to remember that if we can anticipate these behaviors and try to avert some of them, that we will have a more successful relationship with the patients, with the persons with dementia, and that they will be much more relaxed and much more trusting of us. There are also various mental and physical causes for some of the symptoms that we see in persons with dementia. A very, very common situation is a reaction to medication. And I actually should say, instead of medication, I should say medications in the plural. My experience in working with the elderly over the years has told me that it is very common for older patients to be taking many medications for various conditions, and that they often are taking these medications improperly, or their usage of the medication has built up a physical reaction which needs to be monitored, and the medication dosage or even the administration may need to be changed. Infections are very common, and unlike you and I, a person with dementia has no way to communicate the fact that they are suffering from an infection. We have to be alert to these signs